We're starting a new segment and new partnership. So from here on out, each Monday here at 6:30, we will devote a few minutes to healthy living with UNM Health.
Yeah, and this collaboration between KOB4 and UNM Health really means we can share stories from our state's only academic health center and also help you with keeping your family on the track to healthy living.
So here's how it works. UNM Health will produce the stories that you see, but each story will still go through KOB4's editorial process to ensure they meet our guidelines and our high level of journalistic principles.
Tonight's story highlights New Mexico's need for blood donors. It takes 200 units of blood every single day to meet the demands for sick or injured people here. It took nearly half that amount to save just one young man's life recently. Brianna Mortensen from UNM Health introduces us to that man's mother, who walks us through his terrifying treatment, but also miraculous recovery thanks to local donors.
It was probably one of the very worst times of my life.
Brenda Murray is no stranger to witnessing the many emergencies that bring patients through hospital doors. It's part of her job as the Director of Environmental Services at UNM Sandoval Regional Medical Center, a campus of UNM Hospital. But nothing in her work could have prepared her for a phone call about her own son after he nosedived into a cement arroyo on a four-wheeler.
We were told that he was transported via ambulance to UNMH Hospital downtown. At the time, we didn't know the extent of his injuries.
24-year-old Joey Vigil suffered a serious liver laceration, and doctors quickly had to remove a third of his organ. A CT scan after that surgery revealed more damage to a major artery that connects to the bottom of Vigil's heart, so he went back in the operating room for a bypass.
My son was on mass blood transfusion protocol.
Occasionally we get the patient who needs a couple of units because they had a cut that bled. Oftentimes though, if it's somebody who has a surgical emergency, those patients will get probably 4-ish units of blood. Is pretty average.
Vigil received 74 transfusions.
Every time they would come in and administer another transfusion, I remember just saying to myself, I am going to donate blood. I will be eternally grateful, not only for his care at UNMH, but everybody that donated blood.
Vigil's story is a common one. Every day, New Mexicans need blood transfusions for many reasons, and they all rely on blood donors for this life-saving gift.
And we have Steve Crabb here with us tonight. He is a project manager at UNM Hospital. So let's get right into it, Steve. What is the supply versus demand looking like for blood at this point?
The demand is 200 units a day. And if you think about demand is what's actually used and ordered by the hospitals. Mm-hmm. If you put that in perspective, that's 6,000 a month, 72,000 a year.
Yeah.
I run a rather large blood drive, and we only bring in just over 100 units of blood. So those numbers are pretty scary.
And that's just average. That's, you know, heaven forbid we have some type of an emergency where the demand goes up even more, obviously.
Yes.
So what do you do when blood drives are not enough? What are your options?
When the New Mexico runs out of supply, they have to ask other states for help and bring in blood from other states. And we've helped out other states before in disasters and hurricanes and other things.
Right.
We've sent some supply to help those other states. So blood donation helps everybody.
Yeah, I would imagine that we're probably not the only ones in this situation. So if viewers are watching, what can they do? How easy is it to help out with this?
Vitalant is the organization that manages all the blood drives. So I would go on to vitalant.org and find a drive close to the donors. There's drives everywhere that occur. Or you can come to the UNM Hospital blood drive. We're having one on February 6th and 7th. And young people especially, young people are not coming out to give. So I would especially stress young people.
Yeah.
Come out and help your community and the nation, really.
It's such a selfless and easy thing to do, that's for sure, and especially is what we're seeing in California right now, where every little bit helps. Steve, thanks so much. Hopefully we help get the word out and get you guys some help over there. Thanks for everything you're doing.